Okay, new placement, let's try this. All right, welcome everybody, roll's already done. For those of you who are still doing homework, remember it is due by March 13th. No ifs, ands, or buts. I will give zeros that night. Anything that's not done, okay? Yes?
The only assignments I have on that is the chapter assignments, the test, and the forums, right?
Right. Yeah, there's nothing crazy hard on this class other than doing your math and doing your homework. So make sure you get it done. Remember, on the grade book, don't be like some people in my last semester that went in there and didn't see any zeros on their grade book, so they thought they didn't have anything due, right? Well, the only time zeros will show up on your grade book for assignments that aren't done is when I go in there and put zeros. But I'm not putting zeros until March 13th, right? So you need to go through every assignment on every module to make sure that you are up to date. Okay? So, any questions on the homework so far?
I missed one.
Anyone? Everybody's just getting acing it? Okay. You know you have to do homework to get questions, though, huh? Some people that are laughing are like, oh, I know, I got like 20 assignments. March 13th. And what's so funny, I sent that email out to everybody. Well, first I sent that notification that said, hey, remember March 13th? And I sent out an email to select few of every class. I did it to all my online classes. That said, hey, you have less than 50% of your points in, so meaning you got a lot, you're pretty behind. And you wouldn't believe, by Monday, when I logged in first thing Monday morning, I had a ton of assignments to grade. So, an ish ton. So no questions? Nothing for me to do on the, yes.
Okay, I don't have a specific problem or question, but I'm remembering back in like chapters 6 through 9 when I took the test and did the assignment, and I was trying to get it done without doing much from the book or practicing beforehand, and then I missed the lecture or whatever. But there were some where it was like several steps, not just dimensional analysis where you can eliminate information or whatever, but it was the ones that were like where you also had to figure in how many times a day they were getting that dosage and figuring that in where...
Like what the total supply was that you needed to give that for a whole week.
So what you need to do with those, the best thing to do is do the dimensional analysis, come up with the dose, okay? Whatever dose you need. And then use your common sense to say, okay, if I'm doing it Q6, it's going to be 4 times a day. So I'm going to multiply that times 4. Right?
Okay.
And so then you know, okay, now I have my day dose. And I'm going to do it for 10 days. So now I need to multiply that by 10.
So when I actually asked my husband about that, then he was saying, hey, so this is, you just think about it and you just figure it out. But my problem was I'm sitting there going, how do I add that to the equation and figure it out and put it into the problem? So, I mean, in everyday life, you would just...
So what we could do with that...
like that anyways?
Well, that's how we do it anyways, but the only thing is you can do it for... you can fit it in there by putting 4 times over 1 day or vice versa, so you get to your day dose, so this many milligrams per day, and then you could do it from there. But you have to remember when you're doing dimensional analysis that the time component is different than the dose component. So when we start, that sentence will make sense when we start doing IV trip rates. Because you'll do your dimensional analysis, and then within that dimensional analysis, then we'll add the time component per minute, per hour, and those kinds of things. Okay. Just remember how he did the space shuttle traveling this many feet per second. How many miles per hour is that? And it's the same thing. He did the first part. He did all the actual conversions of kilometers to meters or whatever to meters. You know, and he did that first, and then he added in the components to do from hours to minutes to seconds. That makes sense? So there's 2 separate things. So that's why it's kind of hard.
I think I was just overthinking it too. And
I think so.
Frustrating me. But then when I went back to the book, I'm looking at the book and not seeing problems like that. But then in the assignment on the online assignment, at the exam and stuff.
Right. Part of the reason we do that is that's kind of like some of that's common sense and making sure seeing you have that. Also, the book only used to have every other answer in the book, in the back, you know what I mean? And then this is 6, right? So number 5, when it came out with every single answer, with how to work every single problem. So that's when we had to create problems. So that's why some problems you won't see in the book.
Okay.
But there are actually applicable problems that you will see in real life.
Okay, well, thanks.
No problem. Okay. Any other questions?
I still keep thinking about that problem. I could not make it.
Because you weren't the only one. Want to do that on the board?
Yeah, can we do that one? That was the most frustrating problem I've ever had.
Okay, so what was it?
The order was for
1/400?
1/400th of a grain. Okay, and then what we had available was 0.3 milligrams. Yeah, 6 milligrams to 1/200th. And then they wanted us to say that really the answer is a half tablet, but
Right. So here's where you're getting mixed up. This is
half
this is smaller than this.
right.
Okay.
And then
Everybody's getting messed up is that this is smaller than this because they're thinking 400 is greater than 200. So what they're doing is we're getting a lot of answers that are 2 tabs.
well, they would kill somebody.
So what you can do is you can convert this, or you can keep it the same, but you have 1. Okay, if you can do it either or, you can have 0.3, or your available, or your order, excuse me. You have 1/400th, and you know that 1/200th is 0.3 milligrams. So that you can just do the deduction that's half. 1.5 milligrams is my order, or is my order. 0.3 milligrams per tab.
Oh, okay. And then you would come up with 1/2.
Right. Or how many grains, how many milligrams are in a grain?
60.
60, right?
Right. That's dimensional analysis.
For 1 grain, or equal to, but what do you have here? 1/400th of a grain, right?
Right.
So you really, okay, so 60 divided by 400. The easiest way to do it is the way I do it, when I have a fraction like this, and I know that the whole is 60 or whatever, then I just do this.
Okay.
Because the whole would be on top, so 60, and then you're taking into 400 parts. That makes sense. So you're making 60 into 400 parts, so it's 60 divided by 400.
That makes sense.
So there's multiple ways to do that. You can just look at it and say, well, 1/400th is half of 1/200.
I knew that, but I couldn't just write that, or you wouldn't have given me credit.
Or you could do 60 divided by 400, and then 0.15 milligrams, and then you
just said, 1/400th is half of 1/200, therefore I would give 1/2 tab. Would that be okay?
That's fine too, as long as I can see that there's some deduction that tells you in your head, instead of plugging it into Google. And I'm getting more and more Google answers, again, that have 1 ounce equals 29.765453, and I have like 6 decimal places. That's a telltale sign, by the way, guys, that you're using Google, if you were wondering. I know you might think that I'm dumb or something, but when you have 6 decimal places, I mean, I'm not judging you guys, but I don't think you guys are doing the work out to 6 decimal places, especially on an 1 ounce equals 29 point blah 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 blah. Okay. Also, when I ask you to show your work, I have the examples on most of them how I want you to show your work. When I grade it and send it back to you, you'll see my example of how I did it. Okay. Yeah. So you can see the work, and that's how I want you to show it. You know, when I say show dimensional analysis to show that 2 tablespoons is how many mLs, and I have, or 30 mLs, that's not showing your work.
1 tablespoon equals 50
Okay.
times 2.
So, it would be 2 tablespoons.
Because he
1
said use
tablespoon
dimensional analysis
equals 15 mLs.
equals 30.
30 mLs. Okay? That's showing your work for that problem. Now I can do that math in my head too, quickly. But the point is, we want to show the work in practice. Yes?
Can we do that problem that you just had on the board from start to finish?
Which, the nitrostat one?
Available was 0.3, which was 1/200.
Okay. If it was me,
But that's not showing your work.
this is showing your work. That's showing that I'm going to do 60 divided by 400.
But how
Bam!
did you get 60?
Because that's
Okay.
I know.
milligrams equals a
6 is
grain.
1 grain.
Goodness, mother effing gracious.
That's a half a credit.
Mother, father. Okay, 60 over 400 gets 0.15 milligrams. 0.15 milligrams times 0.3 milligrams for 1 tab equals 0.5 tabs, or you can put 1/2 tabs. Whatever floats your boat.
Don't be racing.
Get some glare here. Let's see if we can change the angle of the dangle. I heard that.
You're good right there.
Pretty sure you said it. I have one. I want.
Okay, do you have one you want me to do?
Yeah.
Okay, let's do it. One here. Okay, what is it?
What page do you want? We can read it.
Order. Neupogen, 175 micrograms every day for 2 weeks. Okay. And then what's available is 480 micrograms. What is it for 1.6 mLs?
Yes.
Right? And what's the question? He just wants to know how much. Oh, I want you to mark it on the syringe, but we'll just do this on the board.
It's 175 micrograms subcut,
Sub-Q,
sub-Q. Okay.
that's just the route. Okay. 175. Order first. Micrograms.
Right.
Am I available?
Or 80 micrograms. 1.6 over.
So my answer will be in mLs.
Correct.
So 175 times 1.6 divided by 480. What does that tell me?
176.
175.
Whoops. 175 times 1.6 divided by 480 equals 0.58.
0.58 mLs. Okay.
Which, because it's
Less than an ml.
sub-Q, would have to be point.
Less than an ml, I can go out to the hundreds because remember the syringes that we
They're more
use?
accurate.
Yeah.
They're more accurate. They're out to the hundredths, so we can give 0.58 ml sub Q. Okay.
Mhm.
Kind of the way that I ran it, I did 175 divided by 480, and
Multiply it by the 1.6.
then 175 divided by 480 that's 0.3645, and then the decimals continue times 1.6 equals 0.5833 continue.
Right. So the only difference is that you did the division step first, and then you did multiplication. But the numbers are still in the same place. The 175 and 1.6 are on the top. Those are the multiplications, and then the divisions are the ones on the bottom. So. Okay. Any others? No. I see you squinting like, I mean, do I ask? Do I not ask? You sure? Okay.
It's cooking.
That's kind of crooked, isn't it? I'll play with it in just a second.
It's kind of a little bit.
Well, I was looking at an angle and lining it up with the screen because it's lined up with, if you look at the top of the screen, it's kind of more lined up at the top of it. Anyways, okay, so I've got problems. Nobody's perfect. Yeah, nobody's perfect. No, don't judge
We
me.
did have our paper right here.
You don't know me. You don't know my life. It did, but it's really, really close. Do you want me to put it right there next to you? Or maybe we can pick up you and that's a little chatter.
Oh, no.
Oh, okay.
Probably on the first video I was on there, I'm guessing.
You dropped a watch.
I remember to bring my cooking thing and jigger.
I think the best thing to do is do it the same way all the time. Then you just get used to doing it. I've been doing dimensional analysis for 2 semesters, so it works for me.
There it is. Okay, let's change this.
Took one for a team. And I have biochemistry where you learn dimensional analysis.
It's a little bit better.
That's better.
I think so. I think that'll work. Okay. So we were talking about, we had just finished the oral medications, right? And we were switching into IV medications. I brought one of each of these today that we can hand out. We have ampules. You guys want to check these out? This is what an ampule looks like. Some medications based on the pH will be stored in an ampule, a glass container instead of a plastic container. And so those are used for medications like fentanyl. Preservative-free things are put in glass packaging, and it's literally one glass vial. And you actually have to break the glass to get the fluid out. Okay? So the most important thing when you're using these is when you put some sort of gauze pad or alcohol swab to when you break it, so that way you don't cut your thumbs. We have to turn in incident reports when we have at Airvac. Airvac, we are a very safety-oriented company. Everything is reported when it comes to safety, so we can do what we call, every month we have lessons learned, and all the safety reports are turned in, and then we have to, everybody is it's like a school project every month, but we have to turn in what we call answers to the lessons learned, and they'll say, okay, so here's a scenario, this is what happened to this person, this is what they were doing, where did we break the chain, what happened here, what could be done to prevent this, and everybody's company does that, and we submit these, they're all compiled by base, and then we submit them to our safety officer. So, one of them was, and I said that's a really good month where the only injury we have is where a nurse was using an ampule and she popped it without because most of the time you can just pop it and not worry about it, but she wasn't watching what she was doing, she popped it and cut her thumb open. So that was one of our safety things for the month, was a nurse that cut her thumb open while she was opening fentanyl. So I guess that's a good safety month when the only thing is a little sliver of glass in your thumb.
That's very cool.
But when we work around helicopters and oil rigs and all those kinds of things, because that's the other half of our company's oil and gas. But anyways, so they can cut you. It is real glass, and so you just pop it open, and I'll pop it open when it comes back around the front. Actually, I'll just pop it open right now. So here's this. You get some sort of something to protect your hand. So I'm just going to use this.
Tissue.
I can do that too. You grab it and pull it away from you. So now you have that's how you get your fluid out. Okay. So if you notice, you'll see I'll pass it around if you want, but there's a nice jagged edge on there that could cut you. But then this is glass, so what do I do to prevent
Sharps.
We'll put it in the sharps, but what do I do to prevent getting glass shards in my patient? So there's needles that have filters in them. They're called filter needles. Okay. So that's what we do to keep it from getting glass in our patients. We use filter needles when we use vials.
Because you draw out of the ampule.
You draw right out of the ampule or the vial. Yes.
So what's the advantage to an ampule versus vial? Why don't they just do them all in the vial?
The ampule versus vial, it all depends on the patient, on the medication and the pH and all those kinds of things. But this must go in the sharps now too, because it's a sharp, I can cut on this. Mm-hmm. The vials, they are a rubber stopper, you can put it in the trash and those kind of things. You don't have to break anything to get to it.
Are ampules usually smaller doses too?
And ampules are smaller doses,
drugs.
of more potent drugs, yeah. So we have really high dose epi that can come in vials. We have our Levofed, which is a pretty acidic, comes in the vial. But you don't want to store Levofed because it's acidic in a plastic container for any length of time, because it will change the components of the chemical compound of the medication. So
They're more single dose too.
vials are always ampules are always single dose. Obviously, if you're breaking glass to get to it. But the vials.
I had to buy brand vials in here.
The vials are what we'll play with next on the lab, and we'll actually use what we call the insulin lab, and we'll actually do some drawing up and using those for that. Okay, here's another one. It's called a mixer vial. I have a couple of these to pass out.
I'm curious.
I hated those things, they're evil.
So, I'll pass it out and you look. These have already been opened, but you notice there's a narrowing on this right here. Where that narrowing is, there's usually a rubber stopper, and this top here is actually tall. to mix, if you can see here, on the, right here on the, that's where the rubber stopper is. When I push down on the top, this water now will go down into this powder substance below, okay? So, I'll pass this back. Yeah, is that a One Direction shirt?
Okay, I went to their concert and it was so good.
Okay.
Me and Violet and all of the seniors, so.
The best part is who you took.
Violet.
No,
Oh,
you're Lucy and her friends, aka a bunch of 8-year-olds.
But me
Who
and Violet had more fun.
Yeah, I was gonna say, who screamed louder? Yeah. Oh my gosh! What's, is that Harry? Is Harry one of them? Oh my gosh, it's Harry! Sorry, I saw One Direction on your shirt and I could not
It was
resist.
so good.
Okay, sorry.
Back
Sorry
off
for
to
this.
the side.
That was so distracting. I looked down, I saw One Direction and Harry's wild hair, and I just.
Yeah.
Alright. Reminds me of that Jimmy Fallon where, what's her name? The famous actress. Worked with him on Saturday Night Live. Bridesmaids.
Polar or Teen?
No, OMG. Never mind.
She's so cute.
Kristen Wiig.
Kristen Wiig, thank you, was on there, and she was her character was Harry. She played as Harry. So, anyways, the good thing, there's a lot of medications that we use that once they are mixed, they're only good for a certain amount of time. Okay, but these medications aren't used very often sometimes. So this, if we mix them and then put them in the Pyxis or our dispensing machines, then we'd have a lot of medications go bad because they're mixed and they're only supposed to last a certain amount of time after they're mixed. So what this kind of is that in between where we can have the exact mLs we need in the same vial as the powder substance we need, and then we can just pop them together and then mix it when it's time to use. So that's kind of what this does. Okay, the next thing is what we call a carbojet or a tubex, okay? Pass these down too. Keep them going. You guys can go the opposite direction. Yeah.
Give everyone one.
I don't know. It's really good.
So tubex is another way to package IV medications. And what the tubex does,
It's a lure lock, right?
so first you have an actual miniature vial here, okay? And it has a rubber stopper on the top. So if I want to, I can take a 22 gauge needle and actually use it like a vial and withdraw my medication directly from the vial, okay? Or if you grab the top and pop the top off, if you look inside of the top, you'll notice on the inside there's a little needle, okay? So that little needle actually pierces it. It makes it so that I have a lure lock. So I can do this, I have this on top. So it comes to you unpierced, okay? When you put it in here, okay, so notice how it's separated. I'll thread this in. If you notice on the bottom, there's a plunger with a thread on it, okay?
Yeah.
The plunge, now when I thread to that, now I have an actual syringe. So, but it's not usable until I turn this, which pushes it up, which makes that collar squeeze down and access my vial. So now when I pop this off, two things, I can has a lure lock on it so I can attach it to my IV tubing, or I can stick a needle on it. I have my needle used. So I can take the screen top off, attach it right to the tubing, or I can thread a needle in there for an injection. Okay. Now I have.
They show they're tapping and tapping and tapping.
Yeah, you want to get all the bubbles out. That's the main thing. Okay, so now I have a usable syringe. Okay.
If you tap it, then do you still have to go down at the angle to squeeze it out, or you can go up at the angle and squeeze?
So you can do either or, whatever
Okay.
gets the bubbles out. Once the bubbles are out, I can give it like this, I can give it like this, I can give it any way I want,
Right.
once the bubbles are out. Okay, as long as it's going into the patient, it's the most important thing. Okay,
Oh, I knew what she was doing.
so
She was
that's the
taking
carb jet.
dosage down.
So I'll pass around the, so you, this is what the syringe looks like. And we used to use these a lot. And then we started using different vials. And it honestly, most of the time you'll see just your pain medications in something like this. The only other medications I've ever seen like this are Valium, and then when we have patients that are hypertensive or have high blood pressure, we have a medication called labetalol, which is a beta blocker that actually lowers their heart rate and their blood pressure. So we'll give it quickly from a carb inject like this. Okay, but that is the main time you'll see it. And then there's a prepackaged syringe here. They're on B. If you see. And there's a medication that we actually commonly give that comes in those prepackaged syringes, and it's called Novanox. Novanox is a low molecular weight heparin, and we give it to every patient that pretty much that's in the hospital to help them not get blood clots or DVTs or pulmonary embolisms or anything like that while they're in the hospital setting. Okay, so and it's actually designed like Lovenox actually has an air bubble in it. And it's actually designed that you actually inject that little air bubble into their skin when you give them a sub-Q shot. That pushes the medication in and retains it so you have a good. And it's only on Lovenox. Most of the other ones you want to clear your air. But it actually has a pre-packaged air in there that's specific for that medication that you actually inject that as part of the sub-Q injection. So, and then actually the vials come in specific doses. So I have a 30 milligram vial, I have a 40 milligram vial, I have a 60 milligram vial, an 80 milligram vial, and a 100 milligram
And
vial.
that way they hurt so bad because that bubble's in there and it's pushing on it.
Why it hurts so bad is because you're injecting a blood thinner, but when you push a needle in, you're also cutting tissue, right?
Right.
At a capillary level, but you're also cutting tissue. And then I push the blood thinner in there, okay? So if I cut at a capillary level, I'm cutting actual vessels, right? And I'm gonna have microscopic bleeding,
Right.
okay? Well, if I don't have anything to clot it, because if that bleeding is going into an anticoagulant, I'm going to get a nice little bruise. That's why that's kind of sore. And also the pH of the medication also causes a little bit of discomfort also. It burns a little bit.
Yeah, they just flat hurt for days.
So we talked about this a little bit already. We have the different syringes. We have the barrel of the syringe. That's where our lines are for either in units or in mLs, okay? This is a 3 cc syringe, or 3 ml syringe. Sorry, cc's out of habit. But you notice here, we talked about this. This is only accurate to the 10th, right?
Yeah.
Meanwhile, we have a 1 ml syringe, and this is accurate to the 100, okay? Just remember that the barrel, the top of the barrel indicates, or actually the edge of the barrel indicates, edge of the plunger against the barrel indicates your dose line, okay? This tip here can either be pushed into a needle or pushed into your lure locks, but it's just the exact size to go in there, but it doesn't have a thread. Just remember, you'll get yelled at during skills testing if you mess this up, so just remember if you go to nursing or a pharmacy, that this plunger needs to remain sterile. Why? Because it's going inside of the barrel, okay? Okay. So we have needles with plastic guards. We saw that, I've showed you guys that, right? We've talked about those. Why do we want needles with plastic guards?
Protect us from needle sticks.
Protect us from needle sticks, because we don't want to have to go through the months of paperwork and HIV and Hep C and Hep B testing and the lovely medication that goes with it, okay? The prophylactic medication. We have the safety guide here. We talked about those. Also, those needleless systems, this is showing how we would put a needle into the lure lock systems, but now we use the thread right in. Just remember, just some reminders. 3 cc syringe, we have the 10th marks, and then these are actually 10th marks. The big marks are the 10th marks, and the small ones are the hundredths, okay? And just a reminder of measure the dose here. And we'll actually, one of our labs coming up, will actually play with, what's that?
I kept looking at that going, so it's the middle of the back of so the point part doesn't count, it's included in
the point part. The reason it's pointed is because the end of the barrel narrows down, and this has to go in and be able to depress all the medication that could collect right here. If I had a flat plunger, it would stop right here.
Okay, so if it was, is it at the back of that thing?
So the edge of your plunger,
Just the very front edge or the back edge? Because it's hard to see in a picture too.
pass these around. Here. Pop a couple of these open.
I think
Everybody look at the end, the shape of the plunger on the inside, the black rubber stopper. Okay.
You wanna just
we're just
take a plunger out?
Yeah, you can take the plunger out and take a look at it. Sasha. Gosh. I thought you were paying attention to the ground. Okay? But if you pull the plunger out, you'll notice that it's actually got a shape to it.
Oh, okay. So
And then if you push it up, it's easier to read a straight line that meets up with the black line, right? Instead of trying to kind of eyeball that point. If I was trying to eyeball that point and I change the angle, look, that point's lined up with 2 now.
yeah.
Or that point's lined up with 0.3, right? It changes on the angle if I was just doing the point. So that's why the edge that is up against the edge of the plunger that's up against the barrel is the easiest line to measure. Okay?
Thank you.
No problem. Good questions.
Doesn't make that clear.
Okay. And we were talking about this a little bit, and this we're going to do a lab coming up where I'll give you an amount, and you'll have to I'll give you a problem. You'll have to figure out the math, and then you'll actually have to mix the medication, and you show your answer by showing me the plunger with yellow fluid in it, where you've made it to the right amount. Okay. Exciting, huh?
Yeah.
So it gets a little hands-on stuff before you actually get into school that allows you to do that. So, just some things to remember with IV medications. The small capacity hypodermics are calibrated in milliliters. Okay. Anything over 1 ml, you're going to use a syringe that's over 1 ml. But that 1 ml to 3 ml range, make sure that you use 3 ml syringe, because it's going to be more than likely that 1 to 3 ml range is going to be in the tenths, and it's easiest to be accurately measured with the tenths with a 3 cc syringe versus a 10 cc syringe. Okay. Just remember that syringes are labeled with the abbreviation mLs. I actually have seen with cc's also. Okay. Just remember that cc's and mLs are synonymous. But on your homework, I want to see mLs, okay? Also, remember, what is the other unit that you might see on a syringe?
CC?
Other than cc's. And what's the problem on your map?
Deciliter?
No, starts with the U.
Units.
Units. Now, what medication am I going to administer with that? Insulin. Okay. So how many mLs is in this 10 ml syringe?
7.8.
What's your final answer?
Yes, that is, no.
Do we need a
That is not
lifeline?
my final answer.
Do we need a lifeline?
No.
Phone a friend? No?
Yeah, that's 8.
7.8. Okay. 7.8 mLs. So that means that these are worth what?
2.
So 0.2. So 7.2 0.4, 0.6, 0.8, and then that would be 8. Okay, so 7.8. Okay, and the other syringe that has a capacity of 0.5 mLs and 1 mLs, just remember, most of the time the 0.5 mLs are used as, and they'll be measured in units for insulin administration. We really don't use very many TB syringes that you see in 0.5 mLs otherwise. But for TB syringes, we commonly use the 1 mLs. Just remember they both can be accurately measured out to the 100th, okay? 100th of meeting 2 decimal places, which reminds me, when I say round to the 10th, how many decimal places is that? 1. It's not the whole number. What's commonly happening on everybody's homework is I say round to the 10th, so you take that 10th and you use it to round to the whole number. Okay, it's common, very common. It's happening a lot more than I actually would like it to. So if I say measure, so I would say round it to the 100th, how many places should you have after the decimal place?
2.
2. That doesn't mean use the 100th to round to the 10th. Okay? And you guys are giggling, but it is happening a lot. Okay? Also, how many decimal places should we measure temperature out to?
The 10.
To the 10th. To the 1 decimal place every time, unless the answer comes to a whole number. Okay?
Or unless it says otherwise.
Unless I tell you to round it to the whole number.
Celsius is the same. I don't honestly
Celsius and,
know the
Celsius and
answer.
Fahrenheit are both to the 10th.
Okay.
Okay?
I didn't honestly know that answer.
Insulin syringes. Okay? We have a 30 unit syringe down here on the bottom. We have a 50 unit, 100 unit syringe. The ones that we commonly use in the hospital are the 50 unit and then this 100 unit. If you look at the difference, this one's a narrower and longer syringe, so these are all on one side. Okay? But on the, this one has a little bit fatter barrel and they're a little bit tighter together. And not only that, you have the zigzag pattern. So 5's on the left, the whole number's on the right. And that's how it reads, okay? So just remember that if you notice that there's a split in between, just make sure you have the plunger on the right line. Commonly, thank goodness, insulin is when we administer in the hospital, it takes a witness, okay? So we pull it up, we have to show somebody. Somebody has to grab your syringe and go, looks like 2 units to me, and hands it back to you, and then you administer to the patient. And not only do you chart it, somebody has to go into your charting and co-sign it that you gave insulin. There's a couple medications like that in the hospital that we give, and insulin is one of them that we actually have to have a co-signer. Those dangerous medications, because 0.2 of an ml is a minuscule amount. You know, like when you compare it to 0.4 mLs. Both are minuscule amounts, not very much different in between, but 0.4 is double the dose of 0.2. So you could cause some sugar problems for your patient. So that's why those high-risk medications are checked off by other nurses.
What other high-risk medications are you talking about?
Other high-risk medications include heparin, certain IV drips that we do, like where you're calculating to micrograms per minute, or some patients will be micrograms per kilo per minute, and those kinds of things. And so like Levophed, dopamine, and other sedation like propofol and other things like that are all high-risk medications that could cause patient harm. Epidural, when we cause anything that has an epidural involved with it, has to have a cosigner with it. Yes.
So why is it like people that have like an insulin pump, they don't have to get it exactly right? Why is that? But then in the hospital you have to.
Because you're not going to sue yourself if you mess it up.
Okay, but like
Pretty
it's
much.
okay, so it's not really like that.
It is a high-risk medication, and the insulin pump is a different kind of mechanism. Okay.
Right.
So the way that works is you have 2 things going on. You have constant infusion, which is a basal rate, which is calculated by your endocrinologist, okay? And then, so that's infusing at a basal rate, and then you have a bolus based on you pump in how many carbs you're gonna eat, and then you pop it in there, okay? So that's how you would manage it at home. In the hospital setting, you get a basal insulin, okay, because we don't use your pump, okay, most of the time. Every occasion we do, but if we do, we'll tell you, hey, what are you going to eat for lunch? I need to chart how many carbs you're eating, and this is how much bolus you're going to be giving. okay? But most patients, we give them a long-acting insulin called Lantus, okay? And that is a 24-hour insulin, so we give that to them. So that's their basal rate, just like that continuous infusion that you get from your pump. And then what we do is we check their sugar before they eat. And we just give them a sliding scale based off of what their sugar is. It doesn't factor into the amount of calories they're going to be eating, okay? But we check it before so we can give them a kind of a precursor insulin bump so that they can consume some carbs.
Okay.
So that's why it's important in the hospital setting that when we give them insulin that we make sure they eat. Because more than once we've given insulin and they're like, oh, I'm not so hungry, and then you go in there later and they're like having a seizure because their glucose is 16 because they didn't eat anything. So, okay. Make sure you remember that dosages must be measurable and appropriate for the syringe used. Okay. So if I have an order for 10 cc's of something, am I going to use a 1 cc syringe 10 times?
No.
No. Okay. So another point here is that the insulin syringe and the tuberculin syringe are different. Confusion of the two can cause a medication error. The main difference between the two is one is measured in mLs and one is measured in units. The actual lines, 2 units is the same as 0.2 mLs, right? 4 units would be the same as 0.4 mLs. But you have to make sure you use an insulin syringe because you don't want to mess that up with a TB syringe. Not in an emergent situation where I have nothing but a TB syringe and I have to have my glucose and I'm at home and I'm a home person, I'm not doing it in the hospital. That's a different situation. You need to get your insulin, otherwise you end up in DKA hanging out with us in the ICU. But use insulin for insulin syringes, and then other small volumes you can use your tuberculin syringe. If it cannot be accurately measured, don't administer. Okay? Does that make sense? Remember we talked about rounding within 10%. That's usually pretty good. Like if I have 125 milligram dose vial of Solumedrol. Solumedrol is a steroid that we use in the hospital. Very common for COPD patients when they come in with exacerbations. They come in and they need a steroid. So we'll give them a 125 milligram dose now, and then we'll give them a 125 milligram dose 8 hours later, and maybe another 125 milligram doses 8 hours after that. Then we start them on a taper, where we go to 80 milligrams per day, 40 times 3, 40 milligrams times 3 per day, and then they're off the Solumedrol. The whole time we're still using that same vial, that same 125 milligrams per 2 mLs. Okay? So if you do the math for 80 milligrams, 125 milligrams of 2 mLs, it comes to 1.28 mLs. Am I okay to use a 3 cc syringe? I can't measure out to the 100, but am I okay to give them 1.3? Is that within 10%? Okay. So that's okay. So accurately though, if I have a medication that needs to be given to the 100, I'm not going to use a 10 cc syringe, is the point. Okay? So accurately within so many percent is okay. Make sense? Alright, so the diazepam label indicates the total size of the vial is 10 mLs. But what's my concentration?
5 milligrams per 1 ml.
Okay. So what's my total available milligrams in the vial?
50. There's 50 milligrams.
50 milligrams, because I have 5 milligrams per ml, and I have 10 mLs. So I can take 5 and multiply it by 10. No fancy math needed, okay? Corvert. Has anybody ever heard of Corvert before? Corvert. Okay, has anybody ever heard of atrial fibrillation?
Yes.
Okay. So if you are a new onset atrial fibrillation patient, we want to get you out of that rhythm if possible, okay? Because if you're in that rhythm, your heart, your ventricles are the only things that pump right, not your atria. And if your atria aren't pumping right, you can have blood pooling that sits inside your atria and forms blood clots, okay? If I all of a sudden have a blood clot slip through my ventricle, and then I pump a big old blood clot out into my bloodstream, I can send a blood clot into my lungs and cause a pulmonary embolism, or I can send a blood clot into my brain and cause a stroke, right?
Or somewhere else in that part of that.
or somewhere can cause some issues, right? That's the whole point. So if we can, we want to keep you out of that rhythm, okay? So what we do is we give you a ton of, we start you on anticoagulants, so that way you don't have any blood pooling. And then we do one of two things. We either give you a medication that hope to convert you, or we give you a shock. We actually take an electrical, we do a synchronized cardioversion, we sedate you a little bit, and then we put those pads up to you, like you see in the movies, and so you're sedated and sleepy, and then we shock you. Okay, pretty cool, huh? So, what we, I'll have to bring a video because I don't have a video of that on speed dial, but Corvert is the chemical version of that process. So what we'll do is we won't sedate you, but we'll make sure that we have the pacer pads on you because this slows your heart down to the point that and chemically changes some things in your heart, hopefully starting it back on what we call the normal sinus rhythm. If that doesn't work, then we'll probably shock you. And if that doesn't work, then we're going to put you on chronic medications and you'll be on anticoagulants the rest of your life, like Coumadin or Xarelto and those kinds of things. Okay. But this is what Corvert is that medication that we give, and when we give it, it's based on a cardiologist. We used to give this when I worked at Banner Desert on the cardio floor. We used to give it all the time because the cardiologists liked it. He'd rather have this than shock the patients. But we always had to have the rapid response team available just in case the patient died, because that's one of the side effects is death. So
My stepfather goes into he does it all the time.
yeah,
And they can't get him to stop.
And it's common. So if we know that we're not going to get you to stop, we're not going to keep giving you medication or shocking you. We'll just give you medication to make sure your atrial fibrillation doesn't go too fast. And then we'll also give you the anticoagulant so you don't throw any blood clots anywhere.
Actually, he meets his doctor at the hospital and he shocks him.
So if you want to sign up for that all the time, if it's reversible, I have a friend who's been shocked so many times and they never change anything. So they're like, I forget it.
No, his will work.
So if it works.
I think they do both.
So we have this label saying that the total vial is 10 mLs and there are 0.1 milligrams per ml.
There's
So how many milligrams are in this vial?
10 ml.
1 milligram, right?
1 milligram.
0.1 times 10, or move my decimal place one place to the right. That tells me that I have a 10 milligrams in this vial, right?
One place? You only have 1 milligram.
That's what I said, 1 milligram.
You said 10 mil. You said
10 mLs.
Oh, okay.
Multiply time. 0.1
Yeah,
milligrams
yeah,
times
yeah.
10 mLs.
Yeah.
One place to the right, 1 milligram. I almost said it not because you loaded me up. You loaded me up. Okay. Epinephrine. Okay. Does everybody know what epinephrine is?
Yes.
That's what you see on Grey's Anatomy when somebody cardiac arrest, like give one of epi now, right? Or if Christina Yang, she's not on the show anymore, unfortunately.
Okay.
Did you ever watch Connection?
Why did you just ruin that?
Christina,
Some of us watch it on Netflix and don't see it.
So many people are upset with you right now.
OMG. It's not my fault that you have been watching the show for the last 12 years. I've invested my time already.
He's dedicated.
You know, I'm dedicated, crazy
I have to
man.
wait every week.
But last night was a rough episode. And hey, every once in a while, I'm not going to divulge, but every once in a while while I'm watching with my wife, something will happen and I'll see it on the board. I'm like, oh my gosh, like this is the stupidest thing I've ever seen because it's the most unrealistic.
I can't watch the zombie show because of that.
And so she'll look over at me, she's like, don't say anything. Because half the time if I have the DVR, I'm like, I'll pause, I'm like, oh, you know that's not right, right? You know that is a bunch of BS and that they would do this, this, and this, and this instead. And she's like, oh, I know, it's a show, get over it. Anyways, Epi.
I saw it on Grey's Anatomy.
Yeah. We stayed at the Holiday Inn Express last night. So, epinephrine, or we don't call it this really anymore, but what's the other name for it? Adrenaline. That's what causes that fight or flight response when we see that we're about to get hit by a Mack truck or that dog's chasing us, right? So that's what our adrenaline glands release is epinephrine. But it comes in we talked about this a little bit in the beginning, it comes in two concentrations, 1 to 1,000 or 1 to 10,000. don't let that confuse you, okay? All you have to remember, if you have a 1 to 1,000 solution, think of 1 to 1, 1 to 1,000. So I have 1 milligram per 1 ml, 1 to 1,000. If I have a 1 to 10,000, how many milligrams per an ml? Per how many mLs?
It'd be 1/10 of a milligram per 1 ml.
Right, or it would be 1 milligram per 10 mLs.
Right.
So just look at what the epinephrine, just look at these 3 zeros. Just think 1 milligram to 1 ml, and if I have 10,000, then I'll have 1 milligram in 10 mLs. Okay. This is a multiple dose vial. We use this for patients, like when they come in and they have an allergic reaction, we give them 0.3 of epi sub-Q right away, and that helps with the allergic reaction. If that doesn't work, then we'll start them on an epinephrine drip at so many mics per minute.
Almost went and got one.
Yeah,
I was covered.
when Mr. Justin here found out he was allergic to an antibiotic and he was covered head to toe in hives, so he almost went and got some of this medication. So, remember epinephrine, 1 to 1,000. What does 1 to 1,000 actually really mean? That you have 1 gram per 1,000 mLs of solution, okay? So 1 gram to 1,000 mLs, 1,000 milligrams to 1,000 mLs, or a 1-to-1 solution, okay? That's just showing you what I was pretty much telling you. Just think 1 to 1, okay?
That's a lot easier.
Right. And if you go into nursing, you'll take a class called ACLS, which is called Advanced Cardiac Life Support. And based on patient condition and what you're doing, you'll have to know the difference between 1 to 1,000, 1 to 10,000. And so many nurses are like, I can't remember, the concentrations are throwing me off. But just think 1 to 10, 1 to 1, okay? Just drop 1,000 after that. Parenteral medications measured in units. Heparin. You want to remember what heparin is? That's the blood thinner. Just remember,
Sorry.
not all concentrations are created equal. So insulin is going to be standard, 100 units per ml. This is 1,000 units per ml. Can I use a unit syringe for this heparin? No, because it's not going to be the same type of units. Okay, unit is just a unit of measure. Okay, specific to the medication. So insulin syringes that have units on it, you only use them with insulin. It doesn't go with other medications that are measured in units, like heparin.
That one you would use an ml syringe.
You could use an ml syringe, yes. Common medication, common dose that we give is 5,000 units every 8 hours while the patients are in the hospital. We give them this because this is a little bit harder, a little bit easier on the kidneys. That Lovenox that I was talking about, enoxaparin or low molecular weight heparin, is a little bit harder on the kidneys. It works better and it has a better release. We don't have to give it every 12 hours or every 24, but it's hard on the kidneys. So if they have marginal kidney activity, we'll put them on heparin 5,000 units every 8 hours. And most of the time, see, and that's the thing with heparin. See, with insulin, 100 units per
So
ml
that's half the
never
time.
changes. No matter what the insulin is, if it's Lispro, Humalog, regular, NPH, 70/30, all these different kinds, Lent, all these different kinds of insulins, they all have 100 units per ml. Heparin comes in so many different concentrations. The ones we use in the hospital, 5,000 units per ml. Okay? The ones you use in IV flushes, 3 units per ml. Okay, so you see how the difference is? So make sure that you look at those labels. Milliequivalents. When it comes to doing your math, I had a lot of people that would email me saying, I don't know how to do milliequivalents. It doesn't matter. Remember we talked about fish in a bucket? Or what was the other analogy I used? Something we could use puppies in a box. You have an amount, you have an actual measurable thing inside of a vehicle, whether it be a box, an ml, or whatever. So we are going to have you convert milliequivalents to milligrams, okay? They're different. We'll always keep these electrolytes in milliequivalents, so don't have to worry about that. So this is 40 milliequivalents and 20 mLs, right? Something that's very important with potassium, must be diluted prior to IV administration. Why?
Because you
Why
just don't wanna
can't
give
it be
them
one
straight
day?
potassium.
What if I give a patient straight potassium?
It'll kill them.
Not only does it burn really bad,
It kills them.
it kills them. That's what they do when they have patients on death row that are getting the death sentence by lethal injection. They get a sedative first, and then they get a potassium chloride injection that stops their heart. So, I heard that. So, just remember all potassium must be diluted, and even when you dilute 20.
What is the dose they give them?
So depending on your in the hospital in the lethal dose, I think it's like 100 milliequivalents. It's not very much, but in direct IV form.
She's just looking for doses.
Yeah. I think it's not. I remember looking it up. It's not a crazy
It's
amount.
not huge, okay.
Mhm. But does anybody else know the other place that we use a potassium injection to stop the heart? Guess? Anyone? Anyone?
Open heart surgery?
In surgery, certain kind of surgery.
Open heart.
Open heart surgery. So when they are going to stop the heart so they can work on it, so they can put them on the bypass machine, they'll hook them up to put the cannula, they call cannulate the heart, so all the tubes, they'll bypass the heart by putting big tubes in and running it through the machine. Once they're hooked to the machine and they're pumping through the machine, they'll deflate the heart and stop it. And then they'll work on it. And then they'll hopefully restart it back up. They cross their fingers every time. They'll shock it a couple times. If they don't, then what they'll do is they'll put pacer wires directly on it and then they come out of the chest and they'll have them on a pacer until their heart wakes back up and says, oh, I think it'll work. So no, but it's a lot more complications if we have to pace you for a couple days. So that's why hopefully you start back up in the OR. But it's not the end of the world. If not, then we'll wean you off the pacer when your heart's good enough, and then we'll pull the pacer wires and you're done. So this is commonly 40 milliequivalents would be commonly mixed in 100 mLs to run over 2 hours, or be mixed in 1,000 mLs to be like a continuous infusion, like 100 mLs an hour. So depending on if you have a low potassium while you're in the hospital setting. But it does burn. That's why I'm very nice to my patients, and I always put lidocaine in with the potassium, so that way it doesn't burn as bad. It still burns.
It still burns. I don't care what they put in.
So let's talk about this. Gentamicin, 75 milligrams IM Q8 hours, and it's available 40 milligrams per ml. Okay. Remember, this is just dimensional analysis, just like the oral medications. I could say give it oral. 75 milligrams oral, and it's 40 milligrams per 1 ml, and you would do the same exact math, right? It's just that the most important thing to recognize is where it's going, and that's intramuscular, okay? So, like I had said before, 1.87 mLs when you do the math out, you can round that to 1.9 and use a 3 cc syringe, or 3 ml syringe, excuse me. Okay.
Why do you keep changing them?
What's that?
The CC and ML?
Because ml is what you're supposed to be using. I've said CC for the last 8 years though, so I started teaching this class. But mLs is what you're supposed to say and use and write down to avoid med errors. Remember why? Because CCs can be interpreted as zeros when you write them down. All right, 500 milligrams IM Q12 hours. Okay, it's available in 0.5 grams per 2 mLs. So I can do all this work, right? Or I can convert this to 500 milligrams, right? By moving my decimal place 3 places to the right. So that'd be 500 milligrams per 2 mLs. And there's my answer. Okay. So either or, if you do something like that on your homework, that's fine. You can just say, make sure you let me know that I would move the decimal place 3 places to the right to get 500 milligrams. There's 2 mLs, so I just get 2 mLs. I'll take that. I just have to understand your thought process. Yes.
I'll do like 0.5 G equals 500 milligrams. Is that good enough?
Yeah.
Or do you want?
Well, we know that we moved it over
do you
3.
want?
We
I
can't
would move the
show
decimal
you
place
this.
to the right.
I would prefer something by moving the decimal place.
Oh, okay.
Because I can type into Google how many milligrams is how many milligrams is 0.5 grams, and it'll automatically come up with 0.5 G equals 500.
Oh, okay, I just put.
Just wanna make sure that you're using this and not
We
this.
know that we're going from the strongest to the weakest.
Right. I just wanna make sure you understand. Cause remember,
Okay, too.
you can cheat all you want in this class, but when you go to the other, on from here where it's actually required, then you're gonna be up the creek, right? So you have to make sure you know this stuff before you move on. Morphine sulfate, half a grain IM stat, okay? What's a grain?
60 milligrams.
60 milligrams, so what would be half a grain?
30 milligrams.
30 milligrams, right? So morphine sulfate in a 20 ml vial labeled 15 milligrams per ml. So does that 20 ml vial matter to me?
No.
No, it just tells me how many doses I probably could get out of there. But is it important for our math?
No.
Unless I ask you, how many doses will you get from this vial? That is just distracting information. Do not plug it into your math, okay? Like I said, your math's gonna have more and more distracting information on these assignments. And don't let it distract you, okay? So,
We need to.
1 milligram, we could do the grains, or we know right off the bat, half a grain is 30 milligrams, because we just talked about that. So we can do that, 30 milligrams times 1 ml divided by 15 will give me 2 mLs. Atropine sulfate, what's atropine? Does anybody know what atropine is?
Yes.
Every once in a while, your heart will slow down really, really, really low, okay?
Oh, is that what speeds the heart up to like a ridiculous number?
So if you're starting to have issues where you're having low blood pressure or simple episodes passing out and those kinds of things, when you come to the hospital and you have this low heart rate, we'll give you atropine in IV form, like a half a milligram dose, and that will bring your heart rate back up, okay? And then you'll probably get flown to Tucson so they can get you a pacer, unless there's some sort of electrolyte problem. If there's an electrolyte problem, I'll correct that. So, more than once we have found patients with kidney failure because they come in because they're having syncopal episodes, they're altered, having low blood pressure. We hook them up to the monitor, they have a really slow heart rhythm, we give them a little atropine, bring their heart up, and we check their electrolytes, and they're renal failure, and they're hanging on to their potassium. They have a really high potassium that slows down your heart. So, anyways, atropine sulfate, 20 ml vial labeled 0.4 milligrams per ml, okay? And we're gonna give 1 to 100 IM stat. So what can we do?
You can do a lot of things.
If it was me, I would take 0.4, or I would, let's see here, I would take 60 divided by 100, right up there, right?
It's 0.6.
Which is your 0.6. So now we know we have 0.6, the orders for 0.6 milligrams, right?
Right.
6 divided by.
And then I can do my math. 0.6 times 1 divided by 0.4. Want me to do that on the board?
Yes.
Sure.
Think that one over everybody's head.
So, remember, to convert those fraction grains into a usable number, we just take, how many milligrams are in?
60.
So 60, we divide that 100 ways, because that's our fraction on the board, right?
Right.
That gets us 0.6 milligrams.
Oh, sorry.
That's our order. 0.6 milligrams times 0.4 milligrams in 1 ml. Now my milligrams cancel out, so it should be 1 point, how many mLs?
1.5.
1.5? Okay. That's the easiest way to just convert your fraction grains into milligrams. Put the fraction number on the bottom. What if it was 3 1/100ths?
3 divided by 100.
60 times 3.
See? Just put a 60 on the top. just remember one thing. If it's a fraction of a grain, is it going to be greater than 60 milligrams?
No.
No. Okay.
60 milligrams.
So if
is
you use
a
that
grain.
trick with using 60 over whatever the fraction part is, and your answer comes out greater than 60, then you've done the math wrong. Okay? Oh, I didn't move it back. Okay. Heparin, 750 units sub-Q daily, and it's available in 1,000 units per ml. So, I like to do the order first. 750 times 1 divided by 1,000. Okay? I like to do it in reverse order than the book shows you,
It's just 75.
which is 0.75 mLs. Okay, that's measured up to the 100th and it's less than an ml. What size syringe are we going to use?
1 ml.
1 ml syringe. Penicillin G, 500,000 units IM twice a day. Anybody ever had penicillin G before?
No, because I'm allergic to it now.
It's like a peanut butter shot. Feels great.
Oh, special.
Thank goodness it's in a small volume. Okay, but it's very thick. So I would put the units first that I have for the order. So 500,000 units first. Then I would multiply that 1 ml divided by 300,000 units, cancel out my units to get my 1.7 mLs. If I have 1.7 mLs, what's the best syringe to use? 3 ml. Okay, it's 1, 3, 6, 10. Usually they're at sizes and they have a 12, 20, 35, and 60. Demerol, 65 milligrams IM, and Vistaril, 25 milligrams IM for pain. Okay. Why would I have those two medications together? Vistaril isn't a pain medication.
Does it relax?
It's still
What the Vistaril does, you'll learn this in pharmacology if you haven't taken it already, it creates that synergistic effect. So you can use less of a narcotic and have a greater dose. Does that make sense? That's why we mix oxycodone and Tylenol for Percocet. Oxycodone and Tylenol together have a better effect on pain than just oxycodone by itself or Tylenol by itself. Have the same dose. So that's one reason. Or Lortab or Vicodin is hydrocodone and Tylenol. So we'll mix, those are come in a mixed pill because that synergistic effect helps the dose go a lot further. So available 75 milligrams and 50 milligrams per ml of each, okay? So the Demerol dosage is 0.86 mLs or 0.9. This will be 0.5. We can mix them together though to get a total volume of 1.4, okay? And so that's what we'll be straight in the syringe, okay? Demerol can come with other medications. Sometimes they'll come pre-mixed from the pharmacy or pre-mixed from the company, and they'll be in a syringe together. Another one's like Demerol and Phenergan, sometimes given for the same effect. You can find them in the same syringe. Phenergan or promethazine is the other word for it. Or, what is Phenergan? What is promethazine? It's for nausea, right?
Yeah.
Then why do I have it with in my cough syrup?
Well, because it makes it go faster, actually.
Guaifenicin, you can have prometh with codeine is a cough syrup, or promethazine with codeine.
another codeine. If you haven't eaten anything, will make you sick.
Well, the combination of the two together work very well as an antitussive, or stop you from coughing. So,
But yeah, the codeine on an empty stomach can make you sick.
it can for sure, but primarily for that, it's for the antitussive effects. If you look at morphine, morphine has an unlabeled usage. It says antitussive also. Okay. Want to do some questions on the board? Okay, chapter 18. Oh, thanks. If I can make sure I get all my supplies I handed out. Yeah, just throw it as hard as you can. Justin's being a happy helper just coming out. All right, so let's look at page 363, number 16. 363. Number 16. Looperlide. So let's do it. Number 16. Okay, looking at the vial. What is the total volume of the vial? 2.8. What is the dosage strength?
1 milliliter or 1 milligram per like 2 mLs.
Make sure some of you got some points docked on your questions. If I asked for dosage strength and it didn't have it in this form, you need to have the dose plus the ml volume it comes with. Okay? And C. For injection is the route. And if I ordered 1.5 milligrams, what would be the volume I need to give? So my order first, 1.5 milligrams times the available.
0.3 mLs.
Okay.
I just did the way that I figured it out was I did the 0.2 mLs.
And then half of that plus the 1.
And well, I multiplied it by 1.5 since it's looking for 150%
Right.
of the 1 milligram.
Right. Or if you notice here, 1 doesn't mean anything other than it just sits there on the bottom and it would be 1.5 times 0.2.
That's pretty much what I did.
Yeah. Okay. Look at another one.
How do you, well, you just did a pretend if so-and-so amount was ordered, right?
Mm-hmm.
Okay, I'm sorry.
So, let's look at number 22, 365.
Okay. 3 mLs.
Okay. Total volume of the vial.
3 mLs.
3 mLs. What is the dosage strength?
150 mgs over per 3 ml.
Okay, that's one of them. Or what's the one that's the more
50
exact?
50 milligrams to 1 ml.
They are both the same, right? They're the same ratio.
Right.
Just multiple doses.
Okay. What is the route?
Injection.
Injection, preferably IV for amiodarone. Okay. All right. So, does anybody know what amiodarone is?
I've heard of that, but I don't know what it is.
Bueller?
Let me guess, it's a heart medication.
It's a heart medication. Okay. So those cardiac arrest situations on Grey's Anatomy where they say, he's in V-fib, get the thing, get the shot card and get the epi in. Right?
Just like that.
Just like that.
That's right.
The one medication they don't say because it's not as cool to say and nobody would know what it means anyway because everybody's heard epi before. But if they're in VTAC or VFib, they also get amiodarone. Okay? So, my patient.
And then they Google it to find out what it is.
Yeah, they Google it. It's on the line. Has anybody ever seen the movie, is it The Internship with Vince Vaughn and they have to go to work at Google? That's hilarious. I watched it with an older gentleman. He thought it was hilarious because he had a lot of those same questions. We'll put it on the line. We'll put it on the line. Okay, so I have a cardiac arrest situation. The normal dose for a patient that's in a cardiac arrest situation, we give them 300 milligrams IV push now. Okay?
Okay.
So, how much am I going to give them?
As an ML?
Two of those vials.
2 of those vials, or I could do it like this.
6 mLs. 300 over 50.
Okay, 6 mLs. Okay, so we've given that amiodarone. We do good CPR. We've given them their epi, and they come back. Okay, but when we get patients back, especially if they've been in one of those lethal rhythms of VFib or VTAC, it's not uncommon for them to threaten us and say, "I'll do it again. I'll do it again," and they'll do runs of VTAC or VFib and scare you, and then they'll all of a sudden come back. But those runs of VFib and VTAC get longer and longer and longer until they're sustained and they're dead again if we don't do anything about them. So we've given 300 milligrams times 1. So we've got them back, we've got them on the vent, they're doing really good. Then they start having runs of VTAC, that lethal heart rhythm, right? So the next time we do give it to them, we give them 150 milligrams in 100 mLs. So what do I need to do to mix that drip? I have 150 milligrams.
What are you trying to do?
I need to mix that drip of 100 mLs.
Okay, you would have to mix it with, I don't know, but I would assume water.
It's either D5W or saline.
Right.
So
you're gonna use one of those vials and one in, how many did you say, 1,000?
then you add it to 100 mLs. So then to mix that drip, I need to put
Doesn't really matter what
3 mLs in 100.
into.
Right.
Just what matters is it's a solution that can go into a vein, and I can put 3 mLs. Right.
Right.
Okay.
With the bag.
So I've given that. And they start to settle down. We're getting them to the ICU. On our way to the ICU, this patient does it again. And so we thought, you know what? We need to give them another 150 milligrams.
You're gonna put it in
So
as
another
IV.
3 mLs, and then we're going to start them on a drip. But we need to mix that drip. And that drip needs to be 900 milligrams in 500 mLs. So how many vials am I going to need?
Six.
4.5.
Okay, so how many mLs do I have?
Wait, 1, 2.
We're finding out how many mLs we need to add.
4.5.
How much? 12 mLs? Is that right? What's 900 divided by 50? 18. 900 divided by 50 is 18? Did I hear a 9er in there? A walkie-talkie? Okay. So how many vials am I need? Because I have 3 ml vials.
6. That's
18
what I
divided
came
by
up
3.
with.
I could do it all in one, right? I could do it like this.
I did it by 150 and that came out to 6.
No, because that's what it's gonna get to. 1 vial or something.
Using my dimensional analysis.
900 over 150 is 6. That's what I did.
Not 6, not 5.
It's 6 vials.
That was close. So I need to put 6 vials in 900 or 6 vials or 900 milligrams in a 500 ml D5W. Okay, and now I have a drip that I can be ready to use. So after spring break, we're going to have this same patient again. Not only that, we're going to calculate. He needs to get 0.5 milligram a minute for 6 hours, so we need to see how many mLs he'll need for that. and what IV rate they're gonna run at. And then we're gonna figure out after that, for 18 hours, he's gonna run a milligram a minute first for 6 hours, and then he's gonna run at 0.5 milligram a minute for 18 hours. And we're gonna have to figure out that ml rate and see how many mLs we're gonna need, and we're gonna have to see if we have to mix another bag. That's what's coming after spring break.
Okay, so this exam is all due before the 13th.
So, this is it right here. Listen up.
You guys, listen.
We have next week our in-class exam. Make sure that you are ready to take anything that is on chapters 14 through 18.
It says 16.
It'll behoove you to have all your homework and tests done before that day, because you'll use those as a study guide so that you do really good on your in-class exam, because it's worth some points. Okay?
Doesn't look like
You lucky people in the online world don't have to worry about it, but you people in the classrooms, two classrooms worth, have to worry about it. What's that?
It doesn't look like we even studied 14.
If you look on the online modules, chapter 16, the PowerPoint for chapter 16 on that module is actually 14 and 16 together. They're lumped together.
Oh,
So anything on the modules between 16 and then 17 and 18, which is actually 14 through 18, is
Okay.
fair game.
alright. So
Okay.
we need to watch that module.
Any other questions? Get at it.